This video is going to explain how to take very simple records when you have a full arch restoration, but the restoration has multi-unit sites and it has direct implant sites. When we have all multi-unit, we can use our iJIG technique, full digital workflow. It gets a little more challenging when it's direct to implant. So what we do is the prosthesis comes out of the mouth, and as soon as it comes out, take an alginate or an IOS scan of the tissue and the two multi-units, and you'll pick up some of the implants as well. Scan the full arch, because we want to know where the tissue is. We can bring that in digitally. Or take an alginate and pour it up and ship it in with stone. And while the prosthesis is out of the mouth, you'll take our special iJIG analogs and you'll connect them to the multi-units, and you'll take conventional implant level analogs and attach it to the prosthesis as well, to those two sites. So when you have the prosthesis, you're going to have 4 analogs: direct implant, multi-unit, and at that point, once they're all screwed on, then you take a denture cup or a splint cup and you fill it full of stone, and you take the analogs and the prosthesis, set them down into stone like this. This is what it'll look like, a little bit raised above, a little bit above the stone, okay? And then just let that set. Depending on your speed of your stone, maybe 5 minutes, maybe 20 minutes, let it set, fully harden. Once it's set, unscrew it, okay? Now we have an analog model, a verified analog model that you can really go right to final in some situations. And once the prosthesis is off, then you'll take some lab putty. In this case, the doctor used a couple different putties here, but really you just need one lab putty with an accelerant and the other, and just knead them together, and then encapsulate. Let me do it real here. What you would do is you'd have the prosthesis on the model. You would encapsulate it with the material, and you would knead it and push it in the intaglio, and so you capture it. You let that set, and then you pop that off, and then unscrew the prosthesis, deliver it back to the patient, take a bite, take an opposing impression or an opposing model, bite registration, send this to our laboratory, and with this combination, we will make you a prototype for final. In some cases, right to final, but more than likely a prototype, and go to final restoration after that.